Jo Sawyer is always on the go. She doesn't let age or infirmities hold her back. Sawyer says she has the strength to carry on at home, even though her medical conditions qualify her for nursing home care.
I had both eyes operated on for cataracts and glaucoma. And the glaucoma, they can't, you can't cure that. And I have Parkinson's, and osteoporosis, and this is all metal and steel. My back is full of rods, but you see I'm still a-going.
More than a decade ago, Sawyer joined the Advantage program so she could stay in her apartment at a senior citizens complex.
The doctors wouldn't let me live by myself no more.
At least not without help. The Advantage program provides services tailored to each individual's needs.
And they help you if you need help with the housekeepers. They help you find a nurse. They check to see if I have food. They'll call me and say, "Miss Sawyer, do you have food? Do you have electric? And do you need anything?"
The Advantage program began as a pilot project by DHS and Life Senior Services in Tulsa in 1993. It was to allow Medicaid-eligible seniors to get care at home instead of having to go into nursing homes. By 1998, the program was expanded to all 77 counties. It now serves between 23 and 24,000 people each year.
Why the Advantage program was started originally through the Home and Community-Based Services movement was to afford people who had a need for nursing facility level of care an opportunity to make a choice between whether they received those services in their home or in a nursing facility.
Betty Barnett was enrolled in the program a couple of years ago. When we talked to her, she told us her health improved after joining Advantage and moving back into her own home of 30 years.
All the while I was in the nursing home, my sugar stayed out of whack. But after I got home, I got it under control.
Sawyer says in her own home, she has the freedom to have her grandchildren visit at any time. She can also visit friends for a game of dominoes whenever she wants.
You're not confined to where you would be if you were in a nursing home.
That doesn't mean nursing homes are bad. This isn't about knocking nursing homes. It's really about where do people want to be? What kinds of care do they need? Can that be provided in their home? It happens to be a lot more cost effective for those services to be provided in the home.
That's because Medicaid pays about $103 a day to keep a person in a nursing home, while it only costs about $33 a day for the Advantage program to provide services to people like Ms. Sawyer so they can stay in their own homes.
It's about a $300 million a year cost savings to have members on the Advantage program living in their homes.
To put it another way, the Department of Human Services can help 3 times as many people receive care at home for what it costs to provide just one person care in a nursing home.